tell you about Ahmed. Ahmed is a new Canadian of South Asian descent, and he works, despite a university education, behind the wheel of a taxi here in downtown Toronto. I actually once flagged a cab downtown and he was behind the wheel. He absolutely refused to take my money. He is a lovely guy. He's got a huge smile. He has a beautiful wife and 3 kids, and his family is the most important thing in his life. But Ahmed has a problem. He struggles with high blood pressure and diabetes and high cholesterol. These are things that he's genetically predisposed to struggle with, but probably his sedentary job doesn't help much. These, though, are eminently treatable conditions, and there are a wide variety of lifestyle interventions and prescription medicines that can help Ahmed to control those problems and prevent complications. So the problem isn't figuring out how to help him. The problem is that Ahmed doesn't have drug coverage, and the financial burden of his medicines is more than he can regularly manage. So for Ahmed, as for any of us, the choice between sending his kids to camp in the summer and paying for his prescriptions is no choice at all. His family always comes first, and any of us would do the same. And while his kids, starting in January, will be able to benefit from the new Ontario government program that gives prescription medicines free to all children and youth under the age of 25, that doesn't help Ahmed. For him, the choice remains difficult. And what happens next worries me, because I know that he takes his meds when he can afford them, and sometimes he can afford them and sometimes he can't. And as he ages, it's all going to catch up for him. And my friend will experience almost certainly a serious health event. The risk of a heart attack, a stroke, or blindness will become uncomfortably high. And I have to say that makes me mad, because obviously, bringing prescription medications under our public programs is so obviously the unfinished business of Medicare. So let me make the case. First of all, the need is pressing. I don't know how many people in this room don't have drug insurance, but if you go out and you ask the Canadian public, it is a fact that now, today, 1 in 5 Canadian households reports that someone in their household is currently not taking their medicines as prescribed, specifically because of concerns about cost. That alone should make us want to ask. And here in Ontario, people who are over the age of 65 and therefore have public drug coverage are 3 times less likely to skip a prescription than those who are under the age of 65 and therefore don't have access to public drug coverage. Because like Ahmed, like all of us, they have to make choices between prioritizing food and shelter over their prescription medicines. And in case you think the status quo is something to be proud of, I have news for you. Our totally haphazard multi-payer system has an endless list of dysfunctionalities. Plans and coverage are inconsistent. Fragmentation works against economies of scale, which drives up costs. Inefficient bureaucracies are abundant, and the result is that Canada pays far more than other countries for the drugs we buy. Now, for those of you who are here as business people, for the businesses you work in, or for the students who study those businesses, you should know that the cost of private drug plans is a major part of doing business now in Canadian industry, and it is dragging our economy down. For small and even medium-sized firms, people are increasingly feeling in the business world as though they have to choose between their bottom line and supporting the employees and the workers that make their businesses successful by offering them comprehensive benefit plans. And of course, in our big corporations, we essentially see companies running small insurance companies out of their HR departments. But more importantly, I think, is that with precarious and part-time work on the rise, a trend that is not going to go away here in Canada or elsewhere, we are going to be failing increasing numbers of Canadians every year who will not be in the kinds of jobs that are going to give them, benefits for life. And that won't just be low-income people like Ahmed. It's people who are self-employed. It's sometimes highly paid consultants. I was speaking with a lawyer at a talk the other day who was saying to me, he's a very financially successful guy. He has Crohn's disease. He takes a drug that costs $100,000 a year. How many Canadians do we think can afford something like that, and what kinds of choices or options do we think that he would have? He said to me, I could never leave this job at the firm that I'm at now and go out and start my own private practice. I'm trapped in this job because I need the drug coverage. So every one of us is a job loss away and a cancer diagnosis away from facing the kinds of choices that Ahmed makes every day.